Welcome to Say Yes to Chocolate, the podcast where better is the goal, not perfect.
We're your hosts, Dr. Becky and Sara B, bringing you simple, science-backed wellness with a side of real life and a sprinkle of chocolate love, because balance should taste like joy.
If you're ready to simplify your health and thrive in your 40s, 50s, and beyond, you're in the right place. Let's do this.
Welcome back to Say Yes to Chocolate, episode number 5. Today, we're talking about something that affects every single one of us, our bones, specifically risk factors that impact bone health.
Yes. And here's the deal. Some things you can't change, like your age and your heredity, but there's plenty of things that you can change that can make a huge difference. And a lot of them are just small shifts.
If you've ever wondered, am I at risk for osteoporosis or what can I do to protect my bones? This episode is for you.
So let's start with the things that we can't change, because knowing them helps you make smarter choices about the things that you can change.
All right, hit us with what are the big ones.
First up is your gender. Women are a lot higher risk, especially after menopause when estrogen levels start to drop off. Estrogen is very protective for bone health. So when we start to lose estrogen, our bone health starts to become more difficult to maintain and then obviously continue to build. The other is our age. And again, we reach peak bone mass at about the age of 30. And then for the next 1 to 2 decades, ideally we can maintain that bone mass. And then once again, menopause hits and we start to lose estrogen, which is a huge driver of bone and muscle mass, we start to lose bone density, sometimes upwards of 10 to 20% through the menopause process, and then about 1 to 3% on average post-menopause.
And genetics. If osteoporosis runs into your family, you're at a higher risk too, right?
For sure.
Okay.
Yeah. If you have a mom or a grandmother or like an older sister or older sibling that's been diagnosed with bone disease or osteoporosis, huge risk factor.
Huge risk factor, sure. But what about like medical conditions, right? Because some of us just do have stuff we're dealing with. So how does that affect our bone health as well?
For sure. Medical conditions can play a huge role. If you've had cancer, or specifically the treatment for cancer, which is chemotherapy, chemotherapy is very bone wasting. Hopefully, if you've gone through that process, your provider, whether it's your oncologist or your general practitioner, has already visited with you about starting with the screening test to monitor your bone health. Some other big ones that are really common is thyroid disease. Thyroid disease is very bone wasting and hard on our bone health. Celiac disease, Crohn's disease, really any disease that affects your gut is going to have a major impact on your bone health on 2 levels. They typically are very inflammatory. So inflammation affects your bone health, but then it also typically affects absorption. Okay. So absorption of key nutrients to build bone is usually affected pretty negatively. And then there's a lot of women that suffer from conditions like GERD or reflux, or heartburn is another word for that. And unfortunately, the medications prescribed for that are bone wasting because, again, they alter the body's ability to digest. And then autoimmune conditions, things like rheumatoid arthritis, MS, polymyalgia rheumatica, really any kind of autoimmune condition. The medications that are prescribed to manage those conditions, typically corticosteroids, are also hard on bone health.
Even though we can't control these, right? Like for instance, like I have Hashimoto's. I can't change that necessarily, correct, right? Or the treatment for it. But knowing that allows me to know, and for our listeners to know, what do they need to do for their bone health moving forward to help.
So sometimes there are alternatives with certain conditions. You can either reduce the dosage or you can have, an alternative, either a different class of medication or just, looking at some different supplements that might be helpful or some dietary and lifestyle changes. But obviously for things like thyroid disease, Hashimoto's is an autoimmune condition. Or for people that have a history of cancer, people that have things like Crohn's disease and celiac disease, there isn't anything that you can do about those. And so you have to be mindful that you have those conditions and just be starting to really be proactive and taking what we're going to be talking about, risk factors that you can change, taking some very specific actions to be mindful and be proactive on your bone health.
Sure. So knowledge is power.
Knowledge is power in this case, for sure.
Yep. All right. So now let's shift to some good news. Let's shift to something that we can actually control and the things that we can actually take action on. What risk factors can we actually control?
Yes, this is the fun part. This is where you get your power back. So let's start off with talking about nutrition. I think probably the number one thing people correlate with bone health is calcium, right?
Yep.
And while calcium is really important, it isn't the only big player in bone health. So you can take a supplement, but you can also find calcium in so many things in your diet. It's not just milk. Milk is great. Other dairy products is great. But I think probably a lot of people don't realize that calcium is found in a lot of our vegetables, specifically our dark green veggies. So dark green leafy veggies, broccoli and stuff like that has a ton of calcium in it as well. Vitamin D3 is pivotal for bone health. Vitamin D3 in regards to bone health, if you kind of think about calcium as like a passenger that's waiting to be picked up from the airport. Vitamin D3 is what allows you to get out of the airport and onto the sidewalk to be picked up by somebody to take you somewhere. So your calcium, you've got to get out of the airport, i.e. out of the digestive tract. Vitamin D3 is what does that. So it transports calcium from the digestive tract into our bloodstream. Then in our bloodstream, we have to be able to have a car, right? The taxi, to be able to get that calcium to its destination and out of our blood vessels. If calcium sits in the blood vessels, first of all, it never reaches the bone tissue, but it also has a propensity to start to calcify and you get hardening of the arteries, which has been a concern with a lot of older people. If you've ever heard, don't take a calcium supplement, that's why. So we need our taxi cab. We need our Uber driver, if you will, and that's vitamin K2. So vitamin K2 picks up calcium after D3 has let it out of the digestive tract, and vitamin K2 directs calcium into the actual bone tissue to be deposited to start to build that bony matrix. So calcium, vitamin D3, and vitamin K2 all need to be combined together in order to have a positive effect on bone health. The other really big one is protein. And I know most people correlate protein with muscle mass, but by volume, our bone is over 50% protein.
Wow, that's
so
a lot.
It's huge.
That's huge.
So our bony matrix is about 50% protein. And if we think about protein as one of the building blocks or part of a structure of building a house, we talked about that in one of our previous podcast episodes. Protein is like the 2x4s. And then calcium is like the stuff inside the house that you're going to furnish the house with. But you have to have 2x4s in order to have structure. So calcium builds that bony matrix that makes up the trabecular part of the bone, the inside part of the bone that gives us flexibility and elasticity and allows us to absorb impact. Those four are really important as far as nutritionally.
Sure. And so let's just talk about vitamin K2 just a little bit more.
Yeah.
If you don't mind, because a lot of people get confused with K1.
Yes.
K1, because we're worried about blood thinners.
Yes.
And clotting factors.
Yes.
Does vitamin K2 do the same thing?
No. So yeah, let's go in a little deep dive. This is my wheelhouse. Get a little nerdy and geeky here with me. Vitamin K is a fat soluble vitamin. And in the body, vitamin K, as soon as you consume it, vitamin K is then converted into K1, which is then absorbed into the bloodstream and monitors or manages your clotting factors. It can also be converted to vitamin K2. Vitamin K2 be fermented. Okay. Vitamin K2 is your Uber driver. It's exactly what it does. It picks up calcium out of the bloodstream and delivers it to the bone. So when you consume dark green veggies, cruciferous veggies, fish, anything that has the fat-soluble vitamin K in it, that's split to vitamin K1 and vitamin K2 is pretty efficient. Sure. We're really good at that when we're younger. But just like most things, the older you get, the less efficient you become at it. That's where K2 specifically for bone health comes in. You can supplement specifically with that.
Perfect. And the MK7.
Yep.
Right. If you're looking on a supplement for vitamin K2.
Yeah, so you're going to see MK4 and MK7. Either one is fine, but if you're looking for bone health specific, you want supplement-wise, you want to be taking the MK7, or at least more of a concentration of MK7.
Awesome. So let's talk lifestyle, right? Because
there
are choices that we make every day. There's a few key ones, right? Like smoking. There's lots of negative side effects to that. Alcohol.
Yes.
Both are big culprits. And then smoking accelerates that loss, but also heavy drinking.
Heavy drinking leads
not
to
just
more
like
frigidity.
In moderation, but just a lot of it.
You know, if you're having a glass of wine here and there, that's fine.
Right.
Having a bottle a day is not. Same thing. You know, if we're drinking a 6-pack of beer every day, probably need to evaluate. Alcohol consumption leads to frailty of the bones.
Perfect.
Yeah.
And then physical activity, right?
Yes.
Like, this is not my favorite thing. I'm working on it.
Does anybody like to exercise? I don't know.
I think there are a few.
I think there are. There's
some
some unicorns out there.
Yes.
I agree.
But how does that actually come into play for our bone health?
Sure. I'm going to split this up and talk in two different realms because with bone health, I think it's super important that we remember the reason we care primarily about bone health is fracture prevention, right?
Yep. Yes.
So there's two ways that we want to be preventing fractures. First and foremost, we want to be preventing falls, and that requires balance, strength, and reduction in joint pain and improving flexibility. Physical activity in anything, whether it's taking walks, you love to go on bike rides, you love to do Pilates or bar classes or go to line dancing. Any of those things will help with your balance, maintaining strength, keeping you upright, and preventing falls. Then the other subset of that is wanting to build new, healthy bone tissue that is both dense and elastic and flexible. And unfortunately, all of those other forms of exercise are not enough to stimulate our osteoblastic cells. We did a whole podcast episode on bone health and bone tissue. So go check out, I believe it's episode 2, maybe 3.
Yeah, I think so. I think it was 2.
Yeah, go check out episode 2 for a deeper dive in that. But we're constantly rebuilding bone. The older we get, the less efficient, of course, we become at that. The body will start to clear out old bone faster than we're producing new bone. So then the whole goal is how do we stimulate that new bone growth and slow down that bone loss. And the only way to do that is to put our bone tissue under load, whether that is jumping, powerlifting, gymnastics, all of that will do it. Or you can do things like osteogenic loading. And essentially, if you think about, if you're on YouTube, you can watch me putting your bone under load. And that is loading the long bones of the body, which basically triggers an adaptive response. That, we're wanting to really work this tissue. We need to get to work. The osteoblastic cells respond to that and are triggered or stimulated to start working. And they start laying down new bone tissue as a protective measure. That, if the load is heavy enough, you will start to produce enough new bone growth to outpace your bone loss. And you will start to build new healthy bone tissue. Sure. So there's two caveats to that. Regular exercise or doing whatever you love, staying active is just beneficial in any way, shape, or form. But if you're specifically wanting to target bone density and bone quality, it's gotta be heavy.
When you're talking about fracture prevention and even just keeping that posture, right? Like if you're line dancing and you have good posture, or walking, standing up straight, because the more upright we are, the less likely we are also to fall.
100%.
So
it's easier on the heart. It's better for the lungs. Digestion is maximized. All of your circulation is improved. So yes, all of the above.
So then let's just talk about body composition, but not necessarily just mainly that body weight and how that kind of affects.
Yeah. So it's kind of crazy because every other aspect of health, if you're overweight, it's not good for you. But when we're talking about bone health, because bones respond to load, the heavier you are, typically the more healthy your bone density and quality is. Being very thin or a very slightly built woman is a risk factor as well for thinning bones and then bone disease, osteoporosis.
Okay. So the next big category really is medication.
Yes.
This is just really like you need to be aware, correct? So what are those medications that are not so bone friendly?
All right. This is a really big one, Sarah. Sometimes there's nothing you can do about it. But again, knowledge can be power.
Yes.
We have a lot of people who have come to us, or we talk to even friends or family members that are just shocked by a diagnosis of osteoporosis. They're healthy. They've tried to do everything right, but they have a 20-year history of taking acid reflux medications, or they have an autoimmune condition or asthma even. And they've been on corticosteroids for a number of years, and they didn't realize that those are bone wasting, that those are very hard on their bones. Either they were told when they first started the medication and forgot, or they just weren't made aware of it at all. So this is an important conversation.
Yes.
It's an important conversation for you to then have with your medical provider or your prescribing physician to see if there are alternatives. But the big ones that I think are probably the most prevalent or the most common are proton pump inhibitors. Those are medications for GERD or for reflux. Yep. They're things like Nexium, Prilosec, omeprazole over the counter. If you are taking those are acid reducers. And they do reduce the efficiency of the body to be able to break down and absorb nutrients. And so that is one of the side effects is osteoporosis. So you need to be aware of that.
Right. And they also affect how your body absorbs calcium. Correct?
Yeah. Calcium you need is acid base in your stomach. Sure. So anything that you're taking that reduces that is going to make it much more difficult. Yeah. Another big class of medications is corticosteroids. And those are typically prescribed in autoimmune conditions. A lot of people who have asthma or any kind of allergies are prescribed corticosteroids. They're also prescribed to manage pain or nerve damage and that kind of stuff. And of course, the older you get, the more prevalent things like nerve damage and chronic pain are. So you also need to be aware of that. Thyroid medications, again, we mentioned thyroid disease. Yep. Thyroid medications also have an impact on bone health. And then another big class that I don't think is commonly thought about are antidepressants. So the SSRI inhibitor class of medication is also bone wasting. So it's big. It's a big class.
Right.
When you think about all of those medications combined, that's a large percentage of the population.
Yeah, it's a very large class. So if you're on any of these, don't panic, but do have a conversation with your doctor. Sometimes there are other options, or at least some strategies to help offset that bone loss that you can do lifestyle-wise. And also just making sure your dose is actually the right dose for you. So even if that's just doing regular lab work.
Yeah.
Double check, right? Just keeping on top of that.
If you're worried about it or you do have a diagnosis and some of these conditions are in your history, definitely. In this case, knowledge is power because you have to have those conversations. If you're unaware, you don't even know that this is possible.
Yep.
Don't stop these medications on your own. Don't let this be panic-inducing and go and throw everything away. You can support your bones with nutrition and other lifestyle factors, the other things that we've talked about, and then have that conversation with your doctor. There should be open communication with your provider or your prescribing doctor.
Yeah. Or even your pharmacist.
Or even,
they have some really great insights too. Yeah. So. Okay, so now let's just make this simple, right? We're all about keeping things simple around here, sustainable. What do we need to be doing to keep this KISS?
Okay, yes, keep it simple and sustainable. Actually, KISS stands for another acronym as well. So first and foremost, K. Know your needs. Your gender, your age, your family history, your medical conditions, any medications you're taking, just know your needs. Just do a general awareness. And that was the point of this whole episode. Secondly, I. Integrate one shift. So in this case, it could be nutrition. Take a look at a calcium supplement that you're taking. Make sure it's combined with D3 and K2. Take a day or two and analyze how much protein you're getting. Ideally, you're going to be getting about a gram of protein per pound of ideal body weight. So if your ideal body weight, not your body weight.
Right. Your ideal.
Your ideal. So if you weigh 200 pounds, but ideally you should be more around 150.
Right.
You'd be wanting to get about 150 grams of protein in a day. Just work towards that. The S, simplify. You don't need to be buying every supplement. We don't need to be making every single lifestyle change. We don't need to go into panic. We just need to simply focus on the few that matter. If you go into panic or this becomes a huge stressor, you're going to negate any positive benefits that you are going to be getting out of it. And the last S for KISS is support. Move your body. Pick up a physical activity. If you really don't do a whole lot of anything, just go for a 10-minute walk after dinner. It'll help digestion. It'll help the body more efficiently absorb those nutrients. So it's a double bang. Maybe, stay connected with a friend or family member. That's stress reducing, and laughter truly is the best medicine. Keep it simple and sustainable. KISS.
And that feels really doable, like one small step at a time.
Yes.
You can just do one baby step. That's my model for life. One baby step at a time.
Exactly. It's not about being perfect. It's just about making progress.
All right. That is a wrap for today's conversation.
If this episode resonated with you, please like and subscribe. And if you're feeling extra sparky, let's leave a review. You like Sparky.
I do like Sparky.
I like Sparky too.
That's so much fun. Yeah.
Also, if you know somebody that in your life, a friend, a family member, that this information could help, and we would be incredibly grateful if you would forward them this episode.
And be sure to join us next episode where we're going to actually take a deeper dive into what Dr. Becky already started talking about today, which is that KISS method, with real life examples of each pillar at work. Until next time, say yes to chocolate. Thanks for hanging out with us on Say Yes to Chocolate.
If today's episode gave you a win, something to think about, or even just a smile, we'd love it if you'd subscribe, rate, and share it with a friend.
Want more? Join our email newsletter so you don't miss a beat, and come find us on all the social channels at Say Yes to Chocolate Podcast for all the quick hints and tips.
And don't forget, you can always send us your questions or episode ideas. We love hearing from you.
Until next time, keep it simple, stay curious, and always say yes to chocolate.